Welcome to Talk with Dr. Agnes. I am your host, Dr. Agnes. Today, we have a special guest joining us. Dr. Hadiza Babatolu is a UK-trained family physician practicing in Middle Sackville, Nova Scotia. With her expertise and experience in family medicine, Dr. Babatolu brings a unique perspective to our discussion on the measles outbreak in Canada. Dr. Babatolu, thank you for joining us as the inaugural virtual guest on Talk with Dr. Agnes.
Thank you so much for having me.
Oh, thank you. And how was work today?
It was busy, but I did call, so it went okay. And I was quite pleased I was able to deal with most of the issues the patients had. So it was good. Thank you for asking.
Oh, our work is usually very busy, very demanding, and we do our best.
It is, especially
Okay,
family. Yes, it can be.
exactly. As you know, the Public Health Agency of Canada is concerned about the increase in the number of cases of measles in Canada when compared to the year 2023. Understandably, everyone is concerned about this outbreak. So we've invited you onto the show to help us raise public health awareness and to discuss prevention strategies and vaccines. Let's dive right into our hot topic for today. The first question I have for you, Doctor, is could you enlighten our audience by explaining what measles is and what are the symptoms?
Okay. So measles is a virus. It's a viral infection. It has, as we've heard from the recent news, I think it's in Ontario and Quebec that we're seeing a bit more cases.
Yes.
Yes. So, but I'm just saying this so that everybody doesn't get too scared, but compared to the rest of the world and Europe, it's not that bad. The number of cases are not as much. So we're just looking. So
even in Nova Scotia here.
Yeah, there you go. So it's a bit consoling. So measles is a virus infection and you get it through the air, respiratory droplets when people cough without covering their mouths, or even when you speak and the air droplets come out of your mouth. You can also get it by direct contact. So that's if someone sneezes without covering their mouth and they sneeze onto a table or onto a chair and you sort of touch it, you can catch measles that way. Most people know about the measles, how it presents. You can have a bit of temperature, a rash, but the rash actually appears like 14 days after you're infected, and you usually are able to infect others like 4 days before the rash comes. So you might not even know you've got it, but you are infecting other people with it, So that's why it's very, very careful to have really good hygiene. When you're sneezing, cover your mouth with a tissue, throw it away, wash your hands. And what you can the common presentations or symptoms will be a temperature, a bit of a runny nose. You could even have conjunctivitis or what we call pink eye here in Canada, and then the rash, So those are just a few of the things you can present with, although it can have a bit more complicated presentations down the line. Yeah.
Absolutely. That was beautifully explained. And I was just looking at the Nova Scotia Communicable Disease Manual as well. You rightly said we have fever, runny nose, the red watery eyes, conjunctivitis, and we also have the Koplik spots.
Yeah, yes. There's a whitish ones the whitish spots you see in the mouth, on the roof of the mouth usually. Yes.
Exactly. Good. Then the next question I have is, who can get measles?
Oh, absolutely. Anyone can get measles. It doesn't matter your age. It doesn't matter, who you are. You can have measles. And especially for people who are immunosuppressed or susceptible, it's a bit worrying. So that's people who are immunosuppressed, little children, babies, the elderly, pregnant women, anyone can catch measles, to be honest. But
You're absolutely right.
We get a bit more worried about those who are more susceptible or more unwell, because it might be a bit of a problem for them down the line.
And what investigations are conducted for measles cases?
Okay. So you can have a blood test. You can have a blood test to check if you've got immunity, or you can have a blood test to see if you've got active disease. So usually if you think you have measles, you should be contacting your family doctor with that information to see if you can have any tests done. So that's a way of sort of finding out if you've got it. And for those who are not sure, a blood test will be helpful to see if indeed if there's no symptoms.
I agree with you. I was actually looking at the Nova Scotia Public Health newsletter that was sent to us, and you're absolutely right. That's the serology blood test, and ideally should be collected within 7 days of the onset of rash. And we also have the nose swab, the nasopharyngeal swab, as well as the throat swab, which could be collected as soon as possible from onset of rash as well. And interestingly, I saw urine. Urine can be collected within 14 days of the onset of rash.
Okay. We heard. The other thing is, I wondered though if it's just the way you do the strep throat. I wonder if, not hoping it happens, but if there's more and more cases where the places like pharmacies can also be able to carry out the test. I was just wondering, but I'm not sure.
I would think so. If they could do the COVID one and, at the time when we're doing the COVID, I would think that might be the same procedure, but I looked at the diagnostic testing for measles. This is Nova Scotia Public Health, and there are varieties of ways, like I said, the nose, the throat, urine, and you rightly said the serology. So it's always important. If it doesn't really matter if an individual can't remember when the rash, the dates of onset of rash, but it's really important if we can include that in the requisition. Because according to the public health, they said, it will determine. So like if it's urine, maybe day 14, then that will be urine, right? And the other ones collect ideally within 7 days. So I guess we have the option to collect specimen in varieties of ways.
True.
Talked about the investigation. So how can individuals prevent measles? You've kind of touched on it earlier on, but could you just remind the viewers how individuals can prevent measles?
Okay. So as I said, it's a disease or an infection passed through respiratory droplets or airborne. So please practice very good hygiene. If you're sneezing or you've got a cold, please use tissue, clean your nose, dispose of it properly in the bin, not just lying around, and wash your hands immediately after, because you don't want to be touching the surfaces, because people can actually get infected if they touch a surface that someone has touched who's infected with measles. So, and if you've got the symptoms, and try and stay away from people who are susceptible, who are immunosuppressed, so that you don't pass it on them and make it worse for them, because the way they might present with the illness might be really, really severe compared to somebody who doesn't have any issues with your immune system. So that's another thing. I mean, that's another way of preventing passing along infection.
Transmitting the infection. Yeah.
Infection. And if you're not sure, please just stay away from people.
You can't go wrong with that, can you?
Yeah. Good hand hygiene is so important. And I know some of us, that some people mask, some do not mask. I think just for the sake of others, if you're having a cough or cold and things like that, maybe you should mask up just to protect your loved ones, just for that period, so that you don't share where you've got. Yes.
Exactly. Thanks, but no thanks. In addition to all you said everything. The only thing was that stay home when you're sick. Yes, contact the local public health office or your healthcare provider. And you've said everything on how you can prevent measles. The next question I have for you is, what are the complications associated with measles?
So there can be quite a bit of them, but I think most people would know. I'm not trying to be a scaremonger, but do you know that it can affect your brain? It can actually cause
encephalitis.
Encephalitis. I do want to use a big word term. Down the line, it can actually, it scares me a bit when I think about it, but it can actually affect, your brain, cause some infection there. Now, you don't want that. You definitely do not want that. So
Absolutely.
I'll hand over to you, Agnes, to do the rest. But, it's one of the big ones that I really get scared about. And because people think, oh, it's just measles, it's just an infection. No, if it gets really severe, that is how bad it can be. So we really need to be careful, honestly. Yeah.
I agree with you. I mean, we have ear infections. We also have, pneumonia. It can cause infection of the lungs. And obviously, what I would like to stress is that most people really recover fully from measles infection. But obviously, we're talking about, less common or rare cases where we have these complications. All right.
Yes.
Should pregnant women be concerned about measles? Obviously, I just talked with a pregnant woman today, actually, and we did a part of the prenatal blood work, but still, obviously, we checked for measles, and she wasn't immune. And we talked exactly, what we're discussing now, and she was concerned. No, she was not immune. So obviously, she's not immune. No. So we talked about it, and I did tell her that, listen, this, the prevention techniques, and I did advise her to wear a mask, and it will help because this, we're still in the winter seasons and respiratory, we have COVID, we have all the viruses in the air, so people are sniffing, coughing, sneezing, and what have you. So I did advise her to really mask up, and also because obviously she was concerned, but I talked about the less, common complications that could occur. For example, it could lead to miscarriage. It could also cause low birth weight. And I think there's something else I'm missing out. Preterm labor.
Yeah. I also had a parent asking me about that. And when she finished, she said, well, what about me? And I thought that most of the time for our women of childbearing age or who've been pregnant, most of them might not even need a serology or anything because they would have had the test done already. So it's to quickly look into their notes to see if they're immune or not. But I think with the pregnant women, you did a good thing by advising what she should do and explaining the side effects. And did she ask if she was able to have a vaccination?
Yes, she did, but I need to confirm this. But measles, to the best of my knowledge, is that not a live vaccination? And I wouldn't advise her to have that now but I want to double check, but with public health. But measles vaccine is a live vaccine, and I don't think that's safe in pregnancy. But obviously now we're dealing with an outbreak. So I just wanted to confirm if that would be appropriate for her, especially during this, circumstance that we're in. But normally, I usually advise that, okay, you're not immune, inform the patient and say we need to catch up with the vaccinations post-delivery, right? But we're dealing with a special situation right now. So I told her that I will confirm and let her know.
Yes, that's true. You're quite correct. They do say don't give during pregnancy, and we do need to confirm that. But I'm just wondering if on the basis of risks and benefits, if the benefits outweighs the risk, I think it's not absolute contraindication. I think I read that an absolute contraindication, but it's always best to follow with what maybe public health would say down the line. The cases start increasing.
Yeah, absolutely right. I'm going to call public health tomorrow. I did tell her that I'll get back to her, within 24 to 48 hours, pending if I could get through to someone on the phone. But it's important. I can understand, and so other pregnant women would be, especially in this situation that we're in.
Yes.
The next question I have is, what should individuals do if they suspect that they have measles? I think we've touched on that, but just to reframe it again.
We have covered that. It's as you said. Yes, if you do think you've got measles and you're not sure, there are various ways that you can get yourself tested. But most importantly, keep yourself safe and keep others safe. If it's something that you can quickly go in and out and get the test done, do that and get back home and keep yourself away from others. If you need to go into hospital, it might be best to mask up and right from the door, just let them know that this is what you're concerned about so that you're not, sat where others are and spreading it, because
Exactly.
we'll have a lot of people there. So we need to be mindful and we need to be careful. Yeah.
Mindful and careful. I like that. And my final question to you, Dr. Babatolu, is that could you provide information on the immunization schedule for children and adults?
So at the moment, because of what's going on now, we've had new guidelines coming out. So from what I understand, if you were born for the adults, if you were born before 1970, you probably have some immunity. And so you are sort of good to go. But if you're traveling out of Canada or to places that might have a measles outbreak, I think you're advised to have 1 dose of the MMR. Correct me if I'm wrong, because I'm also just trying to, it's all new.
Keep up to date. Yeah, we received this newsletter a couple of days ago. You're right.
And then if you're born between 1970 and 2000 and you're susceptible, so there's a few things. If you cannot give a immunization record of 2 doses, if you don't have a laboratory test that shows you're immune, if you are a susceptible individual or people like those healthcare workers or immunosuppressed or things like that. So those are some of the caveats. If you're born between 1970 to 2000, you need 2 MMR doses. Oh, and also if you're post-secondary, so university people, college students, you need 2 MMR doses. And if you're traveling to endemic areas.
You're right. So individuals born in or after 1970 should receive 2 doses of measles containing vaccines, unless they have documented immunity, that's serology for measles.
Yes.
And then
or if they can show immunization records, or if they can show immunization records that they've had it. 2 doses.
2 doses, yes. And individuals born before 1970 without measles immunity should receive 1 dose of the measles vaccine only if they are traveling to areas where measles is a concern.
Yes. But then also, I think there's another caveat that says, regardless, if you're a health worker or a military personnel or immunocompromised, it's also going to be a bit different. I think so. Yes, I think so.
We will just have to keep ourselves updated.
Yes.
And then for infants and children, 2 doses of the measles vaccines. Obviously, the first dose, as we know, after the first birthday, and the second dose at 18 months.
Exactly. So usually 12 months and 18 months. However, it also now recently said that if you need to travel out of Canada to a place where there's an outbreak, babies from 6 months can have the 1 dose. However, if you have that dose before 12 months, when you get to 12 months, it will be like you've never had the dose. You need to have the 12 months and the 8-month one again. Yes, so that's the other thing for babies. And then if you're less than, if you're from 12 months to 13 years and you don't have immunization records or you're not completely vaccinated, you now are vaccinated as if you've not had any before. So you do the full schedule 2 months up to 13 years.
Let the fun part begin. We have a special Beyond the Conversation segment where we get to know our guests even better. Dr. Babatolu, could you share some of your hobbies, special skills, or insights on work-life balance, especially as a Black African woman in the healthcare business?
Okay, so I'm married to a doctor too, so our lives are really busy. Both two doctors ask.
I
Really
know. That's
busy.
why I asked you, because I know, but I was waiting for you to bring that, to share that, because I know both of you are both family doctors, and I'll be like, how are you guys coping? So
It,
tell us
yeah,
the
it can.
scoop.
So because of that, we try to work almost opposite each other because we also have three children ranging from age from 17 to 9. So of course the older ones, and we've got a 14-year-old, of course the older ones can sort of, most of the time manage themselves. The 9-year-old will still need some supervision and taken to and fro, things like that. So we try to do any of our out of hours work opposite each other. So my husband will do his in the evening. I do mine in the morning, so that after work, I know I finished after work and I can face anything that has to do with the children, taking them to their various sporting activities. Oh my goodness, the travel. Travel.
I know you're a sport mom, so I know. Yeah,
All three of them.
that's another job in its own.
It is. So yes, that's how we try to maintain a balance. And then we try to maybe take walks together just to have that connection. I do not like the cold. So every time we plan and say, oh, we'll go, I'm like, it's snowing, it's raining, it's too
I
cold.
know.
Just say
That's
it.
one thing I haven't gotten used to the Canadian weather, especially when there is a snowstorm or whatever. I've not gotten used to that yet, but everything else, yes.
Yes. Do you know the
So
shoveling? The shoveling is a cardiovascular exercise.
full aerobic workout. That's what I'm saying. Winter weather, no. But
Yes.
yeah, so yeah, you mentioned something really great, which is you try to mirror, because obviously we do out of hours and all that. So it's really good so that you can get to have, protect family time, in the evening. And that's essential in terms of our emotional well-being. So that's actually great.
That's
And
right.
your experience, like I said, in the healthcare business, as a Black African, woman, any challenges? What have you noticed, or what are the pros and cons, if I may ask?
Well, I've just been in Canada. We came in 2021. So I've just been about 2 years working here. But prior to that, I did train in the UK. And of course, I would say I've done most of my work there. So I can give a bit more information regarding being a Black mom physician over there.
Mm-hmm.
And as a trainee and as a doctor in the UK, there were times when you would have come in contact with patients who are not too happy to be seen by a Black doctor and will request for someone else, or they'll say, oh, I don't understand what you're saying, and things like that. So you do get that. It
You're
hurts.
right. It
It
hurts
hurts.
because I've had a patient who said, "Oh, doctor, I can't hear your accent." And with the I was like, "Okay, I have an accent. I'm African. I'm Black. I have an accent." Yeah,
Yes.
I'm really happy that you kind of you brought that up. Yes. Yeah.
Yeah, it
Continue.
does hurt when patients say that to you, and you're thinking, but there are other ways we can communicate. If you can't hear me, ask me to write it down, or we can do it that way, or we could go a bit slower, or we could get someone else in. But the way it's said, it's said in a racial slur way. So, or they tell you to your front, I don't want to see you. And you start wondering, am I not qualified? Yes. Am I not qualified to be here? So because of the color of my skin, is that now going to be an impediment to me moving forward as a doctor? But, to be fair, I had an amazing GP trainer, and she was my ally. She always stood up for me, and she would not even allow, if any, when I was training, if maybe a couple of times I had that, she told the patients, no, that is not acceptable. We will not be doing that. I actually had a consultant in hospital go in and tell off the patient and walk off the ward round. I was like, wow. So
That's
she stood up and
awesome.
white consultant. She stood up for me and things like that. And then I finished my training. I actually became the international medical graduate lead, where I was in Portsmouth. And it was just to help, other international medical graduates to find their footing, to have a place where they can discuss about issues that they might not feel very comfortable saying it.
Yeah.
But I've also found that the older I get, I've become so confident in who I am as a Black person, as a physician, as a mom, as a wife. I've become more vocal, and I don't know whether it's because I'm getting older. I couldn't care less.
Exactly. Honestly, there's this thing about Taylor Swift, Shake It Off. Like, no, I protect my energy now. I protect my, like anything that's just negative energy. No, I'm too old for that. I'm too grown for that. I'm not even entertaining it. I protect my peace, my sanity. And yeah, I agree with you. I think we're getting old.
We're getting older. And sometimes it depends on the time of the day and how I am. Sometimes I'm like, bring it on. I've got the time for you. Let's do this.
Yes.
Let's do this. What did you say?
Depends, you're right. Whether we've had a coffee boost or what.
Yeah. When there's a coffee booth, I will confront you and ask you to repeat yourself and ask you to, repeat what you said. What do you mean by that? I don't cower in fear or think, oh, what will happen? No, I call you out. I've started calling people out.
Yeah.
I call people out. And I think we need to do that a bit more. Some days, yes, you're too tired. There's just so much work to do. And you're like, no, I don't have the energy for this. And you just go on, So, yeah, it's interesting.
Thank you for sharing that. Honestly, we need to talk more and highlight that more. It's more information and education out there for people. And we are human. Doctors are human, and we're not superhuman. And we have families, we have children, we have loved ones, and we deserve to work in a place where it's safe for us to work and we feel it's all inclusive, safety, and that, it's an inclusive environment for everyone to thrive and, and respect boundaries, and so I agree with you. Oh, well, they say when you're having fun, time goes really so quick, and it's come to the end of today's podcast on measles outbreak. A big thank you to our guest, Dr. Babatolu, for sharing her insights and expertise with us on Talk with Dr. Agnes. I hope today's discussion has been both enlightening and engaging. Your thoughts and insights are highly valued. So please share your feedback in the comment section below. For more information on how to become a virtual guest on my show or for health promotion inquiries, don't hesitate to contact me at talkwithdragnes@gmail.com and visit my website at talkwithagnes.com. Please stay connected with Talk with Dr. Agnes on all our diverse social media platforms for updates and content while subscribing to my YouTube channel. By doing so, you'll make sure you receive timely notifications whenever new content is released. If you found this information helpful, please feel free to share it with someone you care about, as together we can spread knowledge and promote better health. Until our paths cross again, this is Dr. Agnes signing off. Keep striving to become your best and healthiest version, and I'll see you soon.